Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you again for coming to our daily press briefing regarding the COVID-19 situation within Montgomery County. So obviously the situation continues to evolve rapidly. We were here yesterday, there were 50 confirmed cases in Ohio. There are now 67 confirmed cases within 16 counties. 17 of those individuals have been hospitalized. Fortunately, we still remain at 0 deaths in Ohio. We are still at 0 cases in Montgomery County, but everyone in this room understands that it's only a matter of time before we document our first confirmed case by laboratory results. No question, we have community spread of this virus in this community. And the virus is spreading rapidly. Every citizen needs to take this pandemic very seriously. I mean, think about this. Think about the social distancing measures that are being applied across this country, across this state, in this community. These are limitations on movement that we have not witnessed in our lifetime. And they, as Dr. Acton from the Ohio Department of Health has indicated, they're targeted and they're layered. And there are going to be more and more restrictions on movement that are applied to control the spread of this virus. And that's very important. We started with trying to contain it with restricting travel and asking individuals who were ill to self-isolate and individuals who may have come into contact with those ill individuals to self-quarantine. But that wasn't enough. And now we're doing social distancing measures in addition to those containment measures. And the virus is still spreading. That should be a sense of urgency to all of us. And we need to do our part to assure that we protect all individuals within Montgomery County. If you are sick, stay home. If you have symptoms, stay home. Most individuals exposed to this virus can provide self-care at home and completely recover. Obviously, you will know when you are so ill that you need to see a physician. Then call your doctor, get an appointment, and make sure that your doctor evaluates you to determine whether or not you need to be tested. Simple actions when you're sick, obviously. Even if you're starting to feel ill when you're in the workplace, cover your coughs and sneeze, right? No sneezing or coughing into the hands. We all know what the elbow does, and we've witnessed it countless times on the internet. Cover your cough and sneeze. Wash our hands. It seems simple, but that is a foundational tenet of public health. Wash your hands with soap and water. And if water and soap aren't available, then an alcohol-based hand sanitizer. Wash your hands multiple times per day. And I know it's difficult to do, but keep them away from your face. All right? I think when we started this, today I had an itch and I touched my beard. Obviously that's a no-no, so I'm equally guilty. We all have to be aware of what we're doing. Don't touch our face, all right? So it's important that as more and more of these social distancing measures are applied, we all understand the urgency associated with it, and it's because we have vulnerable individuals in this community. Not every single person here is as healthy as the other individual. Most healthy individuals will completely recover from exposure to this virus. But there are those that are not as fortunate as the rest of us who are healthy, right? Individuals with underlying medical conditions, elderly, individuals who are immunocompromised. We have to do our part as healthy individuals to protect them. That's our civic duty. So it's a sense of urgency that we have as a community now. This is not make-believe. This isn't just something that's made up that we're asking individuals to do. This virus is spreading rapidly throughout this community, this state, and this country. And we are obligated to help those most in need and protect those most vulnerable. So today we're very fortunate that we have some speakers with us, and I will introduce them. First of all, we have Mayor Nan Whaley, who is going to be talking about a really exciting initiative aimed at helping our citizens affected by this pandemic. Sarah Hackenbrack, CEO and President of the Greater Dayton Area Hospital Association, and then Dr. Joseph Allen, Regional Medical Director for Premier Physician Network. And with that, we'd ask Mayor Whaley to come forward.
Thanks, Commissioner. Good afternoon, everyone. Today, I appreciate everybody continuing to come here at 4 to really have a discussion of what we're trying to do to prepare our community for when this outbreak really starts happening at a faster pace as we see it. We know that it is already among us, so we've done some things to move forward in our community to make sure that we help increase the safety net. Yesterday, you saw Tracy Sibbing here from United Way. Tom Maltzby, the head of United Way, as well as Mike Parks, have done a great job in putting together a fund at the Dayton Foundation. They have already raised $550,000 for this fund to start making sure that when we see gaps that we need to fill, because we're going to see different things than we normally see in this process, that we'll be able to have some dollars to do that, particularly for our nonprofit partners that are providing service to parts of our community. Anybody can donate if they go through the Dayton Foundation. We recognize that this will be a different kind of fund than we've seen from the tornado relief or from the August 4th shooting, because everyone is affected by coronavirus across our entire community. But we do know that there are people that do have the ability to give, and we have to count on ourselves and our community to do that. So the fund is open at the Dayton Foundation. Starting tomorrow, the Dayton Foundation and United Way will start accepting requests from nonprofits that have need to fill gaps. And so let me just talk a little bit why this matters. You know, in a typical day, our nonprofits are doing all kinds of service to help the safety net. And that may be, for example, helping with eviction process or helping with homeless issues. But now those issues are going to become much more complex, especially as we talk about how we have to, maintain distance, how we sleep, having more spread. And so a lot of our nonprofits are going to have a lot more need, and it's going to be a different need than what they're used to. So we're encouraging flexibility among the nonprofits and flexibility from our government partners. And then also we know that they're going to need some money that they're just going to have to get quickly. And so that's what this fund is about. We had a call this morning at 10:30 with a number of nonprofit partners. I just really want to commend their leadership as they start thinking about what this pandemic will mean to Dayton and how we're going to continue to provide services. We got a good update from Dayton Public Schools as they are working to feed students every day for breakfast and lunch, and actually are moving to a weekly delivery, so that way it can, it cannot be delivered more constant, but just be more thorough in that as we continue to learn the best way to provide services. We're going to learn a lot through this process, just as the health folks are going to have lots of transition as well, and so we want to be as ready as possible. So again, encouraging people to donate to the Dayton Foundation. You can go to their website and donate. We will have links for that website as well, and just want to say thank you to the leadership of the nonprofit community, to United Way and Dayton Foundation for this work as we work to provide the gaps in services that we will surely see through this pandemic. Commissioner, as always, thanks for your leadership, and look forward to hearing what these great people have to say.
All right. Good afternoon, everyone. This afternoon, we got to see an announcement from Governor DeWine and in partnership with the Ohio Hospital Association and Mike Abrams, their president and CEO, regarding a collective agreement that has been reached with hospitals all across the state of Ohio. And so beginning Wednesday, actually at the close of business on Wednesday, hospitals across Ohio will be delaying or postponing elective surgeries. Those elective surgeries are the ones that are non-essential. They can safely be delayed as things move forward with this situation of COVID-19. We need to reduce the number of people who are coming into our hospitals, and that it's not a medically necessary emergency at that point in time. That allows us to have that impact on the community spread. And as things move forward, it will also allow us to continue to preserve the necessary personal protective equipment, the PPE that you hear us talk about all the time. Those are those gowns, gloves, masks, face shields, those types of things that are often used during surgeries that we will need to make sure that we are conserving to prepare for COVID-19 so that we can safely treat patients with COVID-19 and keep our workforce healthy and safe. We also need to make sure that we have the number of beds available in our region's hospitals for those individuals who are critically ill. At the same time, we are dealing with COVID-19. Things like car accidents and heart attacks and, on a positive opportunity, births still continue to happen and will continue to happen in our community. And so our hospitals need to be prepared to address the needs of those individuals as well as individuals who could potentially have COVID-19. There's really an essential relationship between the physician or the surgeon who would be conducting these surgeries and the patient that they're treating. And so the physician and the patient relationship will continue to be the dominant force as the determining factor of a conversation of how surgeries move forward, when they would be postponed, or when they be activated. And surgeries that should continue, there will be a situation when a surgery will continue if there's a threat to a person's life, limb, or organ system, if there is a risk of metastasis or progression of a disease stage. That's commonly something that you might see with a cancer diagnosis where it's staged in multiple levels, or if there's a risk of a rapidly worsening to severe symptoms. Those surgeries will likely continue in consultation with that individual's physician and the patient themselves. And so, again, as the hospitals continue to adapt and transform in this situation, we are following the governor's leadership to make sure that we put in the necessary proactive measures to protect the patient population. Thank you.
Hey, thank you, and good afternoon as well. So I'm here to talk a little bit about the testing center that we're running, or our collection center at UD, with a partnership with UD and Premier. We've run through quite a few of the collections. A lot of patients have come to see us this morning, and it's been very successful. I think some of the folks may have seen the news earlier and watched that. Here to answer any questions you may have with this. They certainly, as we move through this process, this will adjust a bit. Our testing appears to be, I imagine, the next day or two we'll see many more positive results. There's still paramount that these patients have orders from their physicians or their primary care provider, whoever that may be. Those as Sarah just said, that relationship between the patient and the physician or provider is going to be very important in the coming days. Having those orders to be able to get this testing done is pertinent to us. If they have those orders, we're getting them through fairly quickly. There are some folks that have showed up without orders, and we have taken care of that issue with getting them orders in some way, shape, or form from their primary care doc if it was appropriate. Any questions?
What type of turnout did you see today?
Yeah, so the question was how many folks did we see? What type of turnout did we see today? Really, we've tested a little over 200 people as of right now. That does include approximately 40 folks who showed up that did not have orders that we had to reroute. So approximately maybe another 15 or 20 that we had positive flu tests for, so that we sent them on their way with a flu test. So around 250 patients or so.
And a handful of those were folks that showed up and did not get tested because they didn't have orders.
That is correct, yes. And I'm sorry, yes, a handful of those were folks who did not have orders and were not able to be tested today, and that is correct.
If there's anybody from outside of Montgomery County or Miami Valley, are they able to come there to get tested?
Yes, if they have an order from a physician that we're able to validate, then yes. And we have seen many patients outside of Montgomery County. Premier Health is a wide-ranging endeavor, and we've been seeing patients from Dark and Miami and certainly Montgomery County, but also Greene, many other counties in the surrounding area.
Just to reiterate, I spoke about this yesterday a little bit, but when can we expect the turnaround of the results?
Yeah, the turnaround on the results is really, the test itself has become a little quicker, right? So the test results can be available a little bit sooner now as far as a matter of hours. And I'm sorry, the question was about how quickly we can see test results. However, we have some limitations on how many tests we can run at one time. So we are sending those to a regional lab here nearby that is running most of these. Our local lab has the ability to run several at a time, but those are being held back just in case we need to use them for the hospital. But our larger regional centers are running this, still approximately a 1 to 2 day turnaround time. Patient will be notified either by their primary care physician if they have a positive or negative test if this is run, or by the Department of Health, depending on how that runs for them.
I know that at this point the positive tests aren't necessarily even, they're not necessarily indicative of what's really happening in the community. We know the cases are here, but on the confirmed tests, you anticipate that we'll probably get our first positive tomorrow or the day after?
Yes, the question was when do we anticipate our first positive test? I would say our first batch of testing that comes through, which will probably be tomorrow, will probably have a top positive test in it.
How many test kits do you guys have?
Yeah, so currently the number is not exact, but you can figure around 3,000 or so. There are some testing kits that are reallocated and certainly held back for hospital patients that we may need to use, but you can figure on about 2,500 to 3,000 tests that we have available currently. That number is slated to increase as we get more stock in.
The number of people you're seeing, is that something you're able to handle? I mean, how many people does it get to be before it's too much for you to?
Yeah, the question is, are we able to handle the number of people that have come through right now? We don't know our limit on that just yet, on how many we're able to handle coming through, but the process was designed very well. It's very efficient. Our biggest hang-up is really just making sure they have the order, getting their ID, registering them for this test. Once they go through, we're moving them through pretty quickly. Like I said, today we really were moving through very efficiently. We saw 250 cars come through. Really, there wasn't much of a backup. First thing this morning, there was a bit of a line. After that, it's been pretty smooth sailing. Well, if there's no further questions, I appreciate it. Thank you very much.
No, if you have any other questions, just let us know.
Will it be open on weekends?
Currently, we don't know how long this is going to, I apologize. Will the testing center be open on weekends was the question. We don't know exactly, but I would anticipate that yes, the plan right now is to have that open on the weekends. Stay tuned. Things are liable to change, very agile, but right now we're planning on keeping that open.
And do the people, when they go through, are they paying you guys or are they paying your doctors?
There is no charge right now coming through. There could potentially be a bill to the insurance. If there is no insurance or what have you, we're certainly handling that on the back end. But as far as the charge for the test, that's handled through the insurance company. We have no charge for the collection at the moment. There could be a potential charge for if they see the primary care provider. Obviously, if there's an office visit or some electronic visit associated with that.
And this might be for Jeff, but I know you guys said yesterday we were looking to try to help people who don't have insurance or under insurance, so how do they kind of work with that?
Yeah, so we're still working through that process. What we're doing is surveying providers in the community to understand capacity, to see new clients, to get them registered to where they can be evaluated. And our hope is that we can report back on that tomorrow.
Sarah, so the governor talked a little bit about today, said it's about 75% capacity right now for Ohio's hospital, pretty typical for this time of year. Is that pretty consistent with what we're seeing here locally right now?
Overall, it is, and the question was in regards to the governor's statement that we're at about 75% capacity in our region's hospitals in the state of Ohio, and that is relatively consistent with where we are in the Dayton region. Obviously, we're at the tail end of our seasonal flu, and so that is a time period where we do typically have a lot of inpatient admissions in the region's hospitals. And capacity is something that we are monitoring multiple times a day with our member hospitals. We have a system that is called SurgeNet that our hospitals report into twice a day, and we report that information to the Ohio Department of Health. And so we're tracking capacity actively.
Have you started to see any sort of uptick yet in emergency room visits? Obviously, we don't have a confirmed case, but has that ticked up at all?
So the question is whether or not we've seen an increase in the emergency department visits. And what we are seeing is not necessarily a number of visits, but we are seeing some challenges of people walking into emergency departments and requesting this test. And it is, in fact, as we discussed yesterday, not a test that an individual can come into either their doctor's office, an urgent care, or a hospital to request. It is something that does have to be ordered by a provider. The other challenge that we're running into in the emergency department is someone coming in to request the test because their employer has required it as part of an ability to return to work. And so if there are employers who are paying attention and watching this issue, we would really ask that you understand that these are not tests that your employee can come in and ask. And right now, while we are still in the early stages of this, we have to conserve the tests for those for whom it's medically necessary. And those are oftentimes the individuals that would meet inpatient criteria to be admitted.
I know one of the concerns also that I've heard from doctors is that people would be showing up really with symptoms that are not an emergency situation. Are you seeing an increase in that happening right now?
Yeah, and so the question was, are we seeing patients who are showing up that do not have symptoms presenting? And really, we are seeing some anecdotal reports of that information. So we would really ask, as our health commissioner has instructed individuals, if you are not experiencing respiratory distress, fever, and cough, and at a point where you can't manage those symptoms at home safely by yourself, your first order of business is to call your primary care physician. That is who is going to know your health history the best and can talk to you about your symptoms and give you guidance about what should happen next.
Back to the kits, sorry. But you guys expect to have to go to these really quickly and have to order more, or how is that kind of
The question was, do we need to order more kits? How are we going to go about doing that? They're already on order. We have orders for this now. Honestly, throughout the country, we know there's going to be shortages of this. They are producing more at a rapid pace. So we should have more. I can't give you a date on that. At our current pace, our testing right now, and the amount that we have enough for this week. That may dwindle as things pick up, but at our current pace, we should be set for the week. Hopefully, we'll get more by then.